Now that people are already here now.
Hello, this is Peter Gravatt.
Hello, how are you?
Good, thank you.
Good. We're just gonna wait for people to join in, and then I think we'll start at 1 o'clock. Good day.
Good day.
Good day to you.
Good afternoon, colleagues.
Afternoon.
Hi, Makato, Peter, nice to see you.
Yes,
Good to see you too.
We're just gonna wait. I hope the other speakers will all log in, and then we'll start exactly at 1 o'clock. Let me just check on the other side because Desigan is sitting on the other room, if he can just log in quickly. But welcome and thank you very much.
So we can mute for now?
Yeah, you can mute for now, and then at 1 we'll start.
All right.
Thank you. Yes, you can log in, eh, Peter, and Dimaga's already on.
All right, so see, where do I log in here?
No, that's why you might.
Is there anything I can do to help you, Peter?
Oh, I'm just trying to see. It didn't request my password. I don't know if I need that in order to see my screen.
No, you're fine. You
Okay,
have
good.
the right. Yeah, you
Excellent.
have the right. All
Perfect.
right.
COVID. What COVID? It's only you searching your phone. And I'm putting it on surfaces. So. I'm supposed to learn how to use my phone with plastic and no part of the website. You disturb him when he speaks. Disturb him when he speaks. Why? Because he wanted to do that to me. That's why he was saying, oh, just do funny faces.
I can handle those things. You haven't met the people in my house. You can do better than that. You can use this phone.
Welcome to the world. We've already forgotten this.
Okay, will you send?
Good morning and good afternoon, everybody. How are you?
Good afternoon.
Dimakata, you're on mute.
I'm not. I'm not.
Everything there. Just gonna start the normal. She just log in.
No problem.
I'm not.
So you then.
I hear you fine.
Can you hear
you
me?
I can hear you.
Okay, great. Thanks for being on. We're going to start shortly. We're going to have a little bit of an interrupted program because the minister is going to join us, but not exactly in the slot that we have.
Okay.
She's currently in a cabinet meeting, and she's going to see the space that she can have, and we'll accommodate her.
No, that's fine.
We're at 58, so we will start on time. So we'll just wait for Momokle Day.
All right.
So everyone's feeling comfortable?
We are.
Yes.
Excited.
Very good.
You can come in. Ntuyaka, come in. Ihana who is? Baba. Ihana who mute. Ihana, it's actually like Baba. It's Jamie, but I'm already in a meeting, unfortunately. Bon. Okay. I don't know why Ihana. But they can't even hear me.
Okay, I think we're gonna be starting. Can you hear me, Tobile?
Yes,
Can you hear me?
Yes, I can hear you.
Okay.
Are we starting now? I just want to go live on Facebook.
Yes, please.
Okay, cool.
Okay, good afternoon, good morning, good evening, depending on wherever you're connecting from. Welcome to this session where we're going to be launching the WRC Water and Sanitation COVID-19 Wastewater and Sanitation Pilot Surveillance Program. Thank you for your time to join us today, and we look forward to a fruitful discussion with you and getting to hear your thoughts and engagement throughout the session. My name is Mamutlodin Tlhagale. I'm from the Water Research Commission of South Africa in the International and Stakeholder Engagement team. And with me on the deck is Tobile Gebashe, who will be hosting the meeting on our behalf. Myself and Tobile will try to make sure that we run the session smoothly, but of course we need your support so that everything runs as smooth as we'd like it to be. So I'll just ask Tobile to quickly give us a presentation where we're gonna just quickly go through the house rules so that we all are aware of how we're gonna be conducting this session and we don't have any glitches. Tobile. She'll be sharing the screen with us right now.
There you go.
Okay, thank you very much, Tobile. So with the housekeeping rules, there's just a few things that I just want to ask you to help us with. The first thing is, please make sure that all your videos are not on. Only the speaker's video should be on when they're speaking, but also Tobile will be trying to help us with that should you forget, and keep your video on. So don't be mad at us when we switch it off. Please make sure that your mics are all muted at all times. And again, if you are not muted, we will do it on our side. So just please bear with us. I think in today's session, we're not going to be having the raising of hands and the participants speaking, raising questions. However, we will have a Q&A session, and I'll just tell you how we're going to handle that. And then we will make all the presentations available via email, post the session, and we will also put all the presentations on the WRC Knowledge Hub on the COVID page that we have there. And then for Q&A, as I've said, so you will see that at the bottom of your screen, you have a chat box and a Q&A box. So we would like you to please, at any point during the session, post your questions onto the Q&A box. And what we will do is at the time where we'll take the Q&A session, we'll take all the questions from there. If we are overwhelmed by the questions and due to time, we're not able to answer all the questions, we'll make sure that the WRC team respond to all the questions and we'll make answers available to all participants. And the chat box, and this is how we're just showing you how you get to the question. And the chat box is mainly used for a conversation. So we'd like you, as we go throughout the program, have a conversation going in the chat box where the WRC team will be there to also respond to some of the questions that you may have. So please keep it vibrant, alive, and we would like to hear your thoughts as people are speaking and so forth. However, when it's time for the Q&A, I will then focus on the questions that are posted on the Q&A, as we have said. And I hope that you are all able to maneuver between the chat box and the Q&A box. Next, Tobile.
We're done.
And with that, we thank you and we look forward to your participation. Please hang around until the end of the presentation or the webinar. And then our first speaker for today is going to be Mr. Desigan Naidu, who is the Water Research Commission CEO. He's just going to try and set the scene for us, tell us why we're here, what we're trying to achieve with you, the context at which we're coming from in establishing this program and so forth. Desigan, over to you.
Thank you, Babakladeng, and good afternoon for those of you on our timeline. Good evening for some of you who are on the Eastern timeline, and good morning to the others on the Western timeline. It is wonderful to have all of you participate in this event. We're looking forward to it really greatly because I think we're launching something very significant today in our part of the world, and hopefully to have some proliferation on the African continent. And I should offer my greetings also to the WASH community on the African continent who are also joining us today. Just logistically, we're going to have an interruption in our schedule in about 20 minutes. Because this is when Minister Sisulu is going to be able to join us, and I'm sure we will be able to accommodate her. But just to set out the scene, I mean, where we are in the world today is in clearly a very difficult space. We're all struggling to manage this pandemic, the first in the digital age, and I think the digitalization of the world has had huge impact on how the messaging around this COVID virus has spread around the world very rapidly, and to some measure has had huge impact, maybe much more so than previous epidemics that had higher numbers associated with it. But our job as a community of practice is to use that tool much more positively, because it also offers us the opportunity to share our experiences, to share our interpretation of our challenges, and maybe most importantly of all, to be able to share our solutions and our thinking around how we can get past this point. So The tool that we're going to talk about today, or the initiative we're going to talk about today, is something that has taken root in a couple of places in the world. Now, I'm sure that Peter Gravett from the Water Research Foundation in the US is going to expand on this a lot more during his presentation. But I don't think he'll mind me saying that part of what we're wanting to do here is to develop a South African chapter of the wastewater surveillance program, and hopefully to expand this into an African chapter, so that together with what we're doing and what's being done everywhere else in the world, we can create a useful mosaic that allows us a toolbox to monitor exactly how we engage our interventions around this pandemic, and to monitor the course of the pandemic, and naturally to engage the issue of the efficacy of our interventions over this time. The tool is a promising one. It promises that for a much lower cost and a much lower investment in reach, we'll be able to get community level indicators of where we are with regards to COVID-19. This is hugely attractive. I should point out, it does not in any way substitute for what needs to happen after that triage, because that triage has to be followed by the regular interventions by the health professionals to do the person-by-person testing and so forth. But it also allows us a platform to build something much bigger going into the future. All around the world, the notion of water crisis is associated with two components to that water crisis. One is, of course, the water quantity issue and the security of supply, because on the back of climate change, we have seen droughts and floods and extreme events of unbelievable frequency all over the world. And it naturally is something to worry about. But the other face of this is the quality issue, because we're sitting in a scenario where water quality all around the world is, one, decreasing. Two, that we have a whole new array of new pollutants to worry about. The emerging pollutants are organic, they're inorganic. We have the issue of microplastics. So organizing for a surveillance system, as we are wanting to invest in the wastewater system here and around the world, will hopefully give us a building block around a much stronger surveillance system around many other pollutants that we have to deal with. Now, you're going to get a lot more of the scientific detail from some very illustrious speakers that we have. And we're grateful to all of you for making time to come and engage us. But we wanted to have a sense of completeness around the seminar, where it went beyond the science discussion. So we're going to rely on Peter to give us a view of what's happening in the global space. Stanley Lepatsi and Nonhlanhla Kalabela from the WRC will talk to our conceptualization of the South African program. But we also have some very key partners with us. Dimakasa Morosi is the CEO of Bloom Water, one of our large utilities in this country, to talk to how the utilities are going to be playing inside the space. We have Councillor Ngubani, who is the chair of the Water Committee of SALGA, and SALGA is the umbrella organization of all the local governments in South Africa, who will talk about the implications for the municipal level, and our municipalities will get involved. And then we have Angela Matthey from the Medical Research Council, and this is the Science Council that is at the forefront of all of our health interventions in dealing with this pandemic right now. So colleagues, I'm sure like me, you are looking forward to both the presentations and the interactions that we're going to have, and we should be smiling a lot more by the time we hit 3 o'clock South African time. Chair, I hand back to you.
Thank you very much, Desigan. And as participants, as we have said, please make use of the chat box for a conversation to keep it running. But now we will go over to our first speaker, which is Dr. Peter Gravett, which is the CEO of the Water Research Foundation in the US, a world-leading water research cooperative that is overseeing research and promoting innovation across all aspects of the water sector in order to improve water services and the quality of water. So Peter, as designated said, is going to be sharing with us the international perspective, his views, his experience with regards to national surveillance, such as the one that we launching today here for South Africa. Peter, the floor is yours.
Thank you so much. Very much appreciate the opportunity to join you all today, and thank you very much for your kind invitation to participate. So I want to give you a picture here of, as Designate noted, what's going on around the world in this area of sewershed monitoring and environmental surveillance of indicators, specifically the RNA fingerprint of COVID-19. And as Designate noted, the Water Research Foundation, of which I'm the Chief Executive Officer, is a global organization. And with this slide, just to give those of you who are not familiar with us a flavor of our focus, our mission of the Research Foundation is to advance the science of water to improve the quality of life. And we have a vision of creating a research organization that really is focused on the science of, as we say, all things water, to better meet the needs of our subscribers in the entire water sector globally. And I'll emphasize that we are a global organization. We operate on 6 continents, and you see from this slide that, of course, much of the intensity, as we're headquartered in the United States, is within North America, but we have research partners around the world, and importantly, WRC is a centrally important research partner of ours on the African continent. What I'm going to be referring to today in large part is the recent international summit that we organized around this very important issue of environmental surveillance of COVID-19 through sewershed monitoring. And as Designate noted, there are organizations all around the world who have historically been involved in monitoring wastewater to understand, to gather information about what's happening in the community. And so, of course, this work is not new, and it's been used quite extensively in understanding the emergence of poliovirus in communities around the world. And it's not new to the Water Research Foundation. And in fact, to Designate's point, we at the foundation have an ongoing project related to monitoring wastewater that's focused on tracking opioid use. We're working in 3 different communities in the United States, working with 3 communities in the United States to track both the use of prescription opioids and also illicit use of opioid substances. And this tool is very powerful for that. So we're not creating something new. We're actually moving towards a focus on the application of this tool to understand COVID-19. Now, one of the things that really struck us at the Water Research Foundation as the pandemic really took hold across the globe is the number of organizations globally that have jumped into this work of sampling wastewater to understand the presence of COVID-19 in communities. And this is taking place across Europe, in many, many communities, and in research organizations in the United States and Australia and Canada. So it's really has taken off. And yet at the same time, because we're dealing with a very new virus, this work on COVID-19 is being developed as people go along, launching projects. And our view at the Water Research Foundation is that the unique contribution that we can make is to bring all of these research groups and utility organizations globally together and say, surely by working all together, we can accelerate progress.
Sorry, Peter, for the interruption. It
Yep.
seems like your slides are only standing on the intro slides. We're not seeing them moving.
Right, and I'm gonna move on to them. So,
Yes, okay, thank you.
so thank you so much. And so we invited globally the world's leading organizations to participate in this summit. And I'm going to give you a snapshot here of some of the individuals who were involved in various aspects of this work. And you'll see that they're representing folks on at least 3 continents. And we focused in 4 different areas. The first was the interpretation of the data that's being gathered. Second is communication. The third, a discussion about how and where and when samples should be collected, and then finally how they should be analyzed. And so if you look on this slide, there are several ways that this information can be used. And just to be very clear, what is being sampled by the various research groups that are involved in this is not actually the virus itself. What we focused on is sampling the RNA, which is the genetic fingerprint of the virus, using very sensitive tools called polymerase chain reaction. And this tool is in essence like almost like a photocopying machine for the RNA, and so the genetic fingerprint. So even though the RNA may be present in very low concentrations in the wastewater, using the polymerase chain reaction, it can be amplified, so possible to be tracked and seen changes in the concentration of the RNA. Those changes track with the number of cases in a community. And so in terms of the ways this information can be used, there's a general, on the left here, the general use cases. The first is trends or changes in occurrence in community, both in terms of early detection and then tracking the impact of various interventions that have been put in place. And that includes both as cases increase and also, as they are in many parts of the world, decreasing. One of the researchers, Gertje Medema in the Netherlands, has demonstrated by sampling in a community before the pandemic arrived and continuing to track the sampling process as the pandemic arrived in the Netherlands, has been able to demonstrate that they can detect as few as 1 to 3 cases per 100,000 population using this tool. So tremendously important in terms of trends. The second is potentially this tool could be used to get an estimate of the number of cases in the community. And I will say that the work on trends is well established. The work on tracking the number of cases is more complicated because it involves a better understanding of the amount of the RNA that individuals who are infected with the virus are shedding. So that is an area that requires additional investment of research. Risk assessment, understanding the risks to utility workers, a very important area of research. And this work can help to inform that. And then finally, tracking the virus and understanding how the virus may be changing as it travels around the world. So to give a picture of these use cases, on the left, as the curve is increasing, and you can think of this as the number of cases that are increasing in a community, simply the detection of the fingerprint of the virus can be very important, and it can indicate when the virus has arrived, or potentially, if you're in a community that has gone through an outbreak and that outbreak has been resolved, you have the ability to have an early warning signal of when that outbreak might return, something that many are very concerned about. In fact, we're seeing just today news reports related to both France and Iran as they've opened up parts of their economies, seeing cases increasing. And so this can be a very powerful tool for that. midway through the event, tracking as we go over the top of the curve and the curve's decreasing, it becomes very important to not only be able to detect the signal, but be able to measure very, very precisely how that signal is changing to have a better understanding of what's happening with the curves. The third graph here is really focused on trying to understand the number of cases, and this requires a great deal of precision. And then late in the event, where currently in the United States, many communities, no, I'll say that some communities are on this downward slope of the curve. Many are not yet on this downward slope of the curve. It becomes very important, again, to be able to carefully measure what's happening. So these are examples of how the tool can be used. In terms of communication, again, we had a very broad representation from a number of countries. We had, I think, 10 countries who included invited participants in the summit, but of course, many, many others participated, including staff from WRC, and we were so glad to have them engaged in our discussion. One of the very important things for us to think about as we're launching these programs is the communications and understanding that many of the sampling and analytical tools will be implemented by researchers or by utilities, but we need to be able to build effective communication with the public health officials who would be using this information perhaps to help inform decisions they might make about, very important decisions they might make about whether there are aspects of community life that need to be curtailed, as has happened in many communities across the world, or whether those can be reopened. And so understanding the audience that we're speaking to, making sure that we're reaching out to these public health officials in the beginning of a process, not after the data has been gathered. It's very difficult to bring a data set to a public health decision maker who will almost certainly be overwhelmed by other sources of information around community infection. It's very difficult to bring data to them and say, here, I have this information that can be useful to you without having first built that strong trust with them. Understanding that we can draw from the past and past experiences working between the water community and public health officials, being very transparent about what the information can tell us and what it cannot tell us, and making sure we have consistent messaging. And some of the thoughts that we had about particular important messages to include is to be clear that we have an opportunity to add value here through this data, which may not be that familiar to many folks, but it presents a great deal of information about the community. That we have to, at the outset, establish the relationship we're looking for between the public and the media and public health decision makers. This, as Designate noted, is a very important source of information, but certainly not the only source of information that people will be using. And then being clear about the story that this information can tell us about what's happening with the pandemic. And making sure that, as I said, we're transparent about where we have uncertainties, but what we know. In terms of sample collection, again, a very large group of experts who participated, and it is very, very important to be focused on what questions we're trying to answer with whatever program that we're putting in place. And so partnering at the outset with the customers of the information that's going to be generated, being clear on the goals of the study, whether we're simply trying to identify when a case may have appeared or when the pandemic may have arrived in a community or returned to a community, or whether we're trying to actually make an estimate of the number of infected patients within the community. It matters a great deal in terms of how we design the study. And that can include whether we're collecting composites of wastewater or whether we're just taking grab samples from different locations. The timing with which we collect samples matters a great deal. And thinking carefully about how often we want to collect samples and how representative they may be of the community. Also, if we want to compare across communities, we need to be very thoughtful about organizing our sampling program to support those comparisons and making sure that we have consistent approaches. One of the things that's very important to note here in terms of the guiding principles is that in our summit, there was a baseline assumption of samples being collected at centralized wastewater treatment plants. And I know in many communities, there may not be a centralized wastewater treatment plant. That doesn't mean that these tools can't be used, but it does mean that we need to be thinking carefully about where we're collecting samples, why, and when we're collecting those samples. We need to be very thoughtful about not somehow inhibiting the operations of the utility or of waste management officials during the pandemic. We need to be thinking very carefully about worker safety and making sure that we're not exposing workers to live virus, depending on where and when they may be collecting samples. It's very important not just to grab a sample, but also to collect information about what was happening when that sample was collected. For example, if a sample is collected during a time of a heavy rainfall and much higher flow through the system, we can expect that that's going to impact the signal. And so we have to record the information of that so that we can interpret the results, understanding what else was happening. And then also thinking about the very pragmatic goals of all the other things that the individuals who are operating these systems and collecting the samples have to deal with. And in many cases, we're at the stage of a proof of concept. We have demonstrated the ability to track trends. We have demonstrated the ability to see the arrival of the virus in a community. And yet there's still some important research that we need to do to help bolster the power of this work. This slide is just indicating how we might use the samples that we're collecting, some for analysis, but also some for quality control purposes. It's very important to make sure that we're including the correct to both control for false positives or false negatives in our analyses. And so it's not just looking for the signal, but it's also making sure that our analytical tools are working appropriately. And then on the sample analysis, the last section that we were focused on, it is very, very important to ensure that the information that we're providing to decision makers is credible. And so it's very important that when we're analyzing these samples, that we're using the appropriate controls to be able to ensure that we can reproduce our results, to make sure that our sampling tools are valid in the results they're providing. And this requires us to include controls in our analyses. And so with wastewater, it's also very important to keep in mind, this is a complex matrix. There is a lot of different substances that are present there. And so we have to be focused on what our detection limits are and how effectively we can quantify the results. Excuse me. So probably enough on the QA, QC issues. As I noted here, the positive controls and negative controls, focusing on potential substances that may inhibit the results, and that can be caused, for example, if we're collecting a sample in an area where there are also industrial operations or mining operations that might impact our sampling results, just making sure that we're cataloging that information. So in terms of the research priorities, and this is where I'm going to wrap up, as the Water Research Foundation, we are a research organization. We work very closely with utilities all around the world. We have over 1,000 utility participants in our work at the Water Research Foundation. And through our summit, we determined that there are several high priority, very high priority near-term research needs. The first is comparing results across laboratories. There are many different approaches that are being used currently around the world. And to date, there has been very little work to determine which methods produce the most reliable results and to identify how results differ across laboratories. And so we are in the process now of launching an interlaboratory comparison of methods for analysis for COVID-19. We're going to be doing this over the next couple of months, so a very rapid process. And we think this is going to add very significantly to the confidence we have in the results. The second area of research is understanding how the genetic fingerprint, the RNA fingerprint of the virus changes over time in the wastewater matrix. We need to know if it's breaking down and how quickly it does, and that can drive important decisions about when we collect samples and where we collect samples within the system. And if we're in a wastewater treatment context and say a centralized sewer system, we need to understand how the genetic signal changes as it travels through that sewer system so we can better estimate cases within communities. The third area is understanding the effects of storage and pretreatment on the samples that we're taking and the analyses we're doing. How long can we store samples that are collected? What temperature do they need to be stored at to be preserved? And what happens if we add additional chemicals to preserve the sample or to eliminate the virus? And so we're currently working with a number of partners to help fund this research. And we're so pleased to have WRC as a research partner and in this effort. And we're so delighted that you've invited us to help inform your process. It's tremendously important and tremendously exciting. So with that, I'll just say that, as Desigan said in his opening, we believe that this tool can be useful in the context of the current pandemic, and we also think we have an opportunity to build to the future. So we're not just reacting to an ongoing challenge, we're able to anticipate and help prepare for future challenges. So with that, I will stop and turn it back over to the chair. Thank you so much for your kind invitation to participate.
Thank you very much, Peter, for your presentation. I think we now have 3 unanswered questions. So I'm just quickly going to take these questions below before we move to the WRC presentation, because it's just a few really. So we had about 5 questions, 2 were answered. And then I just want Desigan and Peter to address these 3 that have not yet been answered. So the first question is saying that literature shows, it's a question from Dr. Ncube. And they're saying that the literature shows that research has been conducted on COVID-type viruses. How is COVID-19 a new virus or emerging pathogen? I'll just ask all the 3 questions, and Desigan, Peter, and the rest of the WRC colleagues can answer. The second question is from Leslie. And Leslie saying that, if I understand, we could not only detect whether there are cases in a community who are excreting coronavirus remnants, but in single large institutions like prisons, old age homes. Can a carefully designed sampling design confirm whether or whether not there is a COVID present in those samples? If so, that will help the health authorities to decide whether to focus on the limited resources, I guess what he's trying to say. So all he's trying to ask is there a design that can help to detect this one? The third question was from Dr. Ncube again. How long did it take you, I guess that is Peter, to develop, validate methods and get them accredited during this pandemic situation? They're just coming out the question. The last one that I'll take for now, we'll still get back to the question, is from Joe. And Joe is saying, as per the virus, okay, he was trying to respond to the virus. He's saying the virus is named SARS-CoV-2 and is the 7th coronavirus. And then the last question from Titus was, what are the main limitations that you consider one should be aware of when using these approaches? So we have 4 questions, and I'll just open the floor to any of the WRC colleagues and Peter to try and address it. I think the one that was directly directed to Peter was the one about a design that can be dedicated to old age homes and so forth.
Right. Yeah, why don't I take a couple of these questions at once and briefly and just say, first off, Absolutely, there is the opportunity to use this tool to understand particular areas within a community. So one could collect a sample at a central sampling point, like a wastewater treatment plant, and that would give an indicator of what's happening across the community. But there's also the opportunity to go up into the sewer shed. If you have careful mapping of your sewer system and you know where the pipes are that are supporting different parts of the community, one could go just immediately downstream of a hospital or of a prison or of a meat packing facility, processing facility, and could detect what's happening in that particular location. So it's very powerful in that way. Similarly, one could go to a particular neighborhood to try and focus in on where an outbreak might be occurring. So that's very powerful. The second is, in terms of the methods, we are going to be launching our interlaboratory comparison in the next 2 weeks. We hope to have the results back by the end of the summer of this year in the United States, the summer in the US, which would be over the course of the next 3 months or so. We hope to have the results done. And we think that timing is very important because many are expecting that we may see a second wave. And we think back to the terrible the influenza pandemic of 1918 and 1919. Many more people perished in the second wave rather than the first. And so it's very important to have these methods done in that time frame. And in terms of limitations, we think that you can use this tool to track trends now. We're confident that we can see trends. There are many more uncertainties when we're trying to estimate the number of cases because we have to have a clear understanding of the level of shedding of viral particles and in particular RNA particles from infected individuals, how long shedding lasts and how shedding differs between an asymptomatic case and a very severe case. So it becomes quite difficult to answer the question of how many people are infected, but we don't in a community, but we don't think that that information is necessarily critical for this tool to be useful. And if you are in an area of which many places of the world have faced the situation where you do not have access to widespread clinical testing, this tool could give you a snapshot, an early warning system of what's happening in the community, which can be tremendously valuable and very cost effective. As I noted, you can see as few as 1 to 3 cases per 100,000. If you try to use clinical testing to find 1 to 3 cases per 100,000 population, you can imagine how many tests you would have to do. With this one, you can do very few tests to pick up that signal. So it's a very powerful tool. Now, I will stop there. Thank you.
Okay, and then I'll give the floor to the WRC colleagues if there's anyone that would like to add to the responses of the question I asked. No?
I can, Mumokadeng, although I think that that Stan and Nons are going to cover some of the issues during their presentation as well. Maybe just to emphasize 2 things. Firstly, thanks, Joe Burgess. You see, people never leave the WRC, they just take a short vacation. So she's answering on behalf of the WRC. Yeah. Thank you. The issue that I want to raise is that we have to exercise caution about over-interpreting the data. You know, Peter made that point that, you know, this is part of a triage. It gives you a macro indicator, and that macro indicator is very powerful and it is very cost effective. But you have to go to the next level of testing and the next level of testing to be very precise about the exact population that you're dealing with and the exact location that you're dealing with. So it's in part, if you like, gives you the beginning of a magic bullet, but it's certainly not the entire magic bullet. And it's important not to oversell that. The second thing that I want to emphasize is this issue of multiple waves. And this is an issue that we have to worry about. We have to worry about really, really seriously. And in South Africa right now, for those of you who are in the seminar from elsewhere in the world, there is huge pressure on the National Command Council to, in fact, declare an end to the lockdown. because it's very uncomfortable to be in a lockdown. And there are issues about the economy and how the economy is doing and folk being out of work and the rest of it. All of that is true. But this very wave-like nature of these kinds of epidemics is what you've got to watch out about, because if you open up too quickly or without the right parameters in place, you could really be in a much worse position than you currently are. Thanks, Chair.
Thank you very much, Des. I'm seeing the questions are really now coming in, a lot of them. We will take your questions, but I want us now to just move to a presentation that will be jointly done by Dr. Nonhlanhla Kalibaila, who is the Research Manager for Drinking Water Treatment and Quality at the Water Research Commission. She will jointly do the presentation with Professor Stanley Lipazi, who is our Group Executive for Research and Development at the Water Research Commission. So we'll give them a chance to deliver their presentation as you keep on continuing with the conversation. And I'll ask that colleagues should just try to respond to the questions that are there, the ones that you can. There's a lot of technical questions that I'm seeing there. If you are able to respond, please help to respond so that we minimize the number that we need to deal with after the WRC presentation. But for now, I will hand over to Nonhlanhla and Stanley to talk to us about the strategic overview of this program that the WRC is launching today and will be jointly implementing with our key partners in the country. Over to you, Stanley and Nonhlanhla.
Hello, good afternoon, and also good morning, and also good evening or good night to all the delegates. It's actually nice and a good thing actually to hear the experience from the US, from Peter, and especially from the Water Research Foundation. So we are grateful about that. Today we are going to share with you the work that we want to start or that we want to initiate. And the title of that, we will call it Environmental Surveillance of COVID-19 in South Africa. So as we know that the COVID-19 is a respiratory disease, it actually infects individuals in communities and also patients that actually have this disease, and they shed the virus into the wastewater and sanitation environment. So we would want to look at this environment, because we know that they are the environment that receive the shared virus, respiratory, and also the one that goes through the gastric intestinal tract. So something that Peter has also mentioned, the genomic or the material, the genetic material. We know that it has been found in some studies in feces or in stools, but what we know, what we have read, is that no infective strain has been confirmed yet. So it is actually important for us actually to also to note that there are also studies that suggest that the virus may survive in stools, and there are, in some studies, they found that it can actually survive for some days, 3 to 4 days. So therefore, the interconnectedness actually that is provided by the wastewater facilities or networks is actually of interest, because we see that there is a potential actually for that to facilitate exposure, as it has been noticed in other countries like Hong Kong. So my slides are not moving. Can I get an assistant there? But the next slide actually is about the South African conditions. Sorry, I'm struggling with my slides to move. Chair?
Yes, Stanley? Yes.
Okay. Yeah, okay, I've moved now. Okay, in South Africa, as we know that we're a country of many contrasts as well, so COVID-19 has not only challenged us in terms of our own health systems and in terms of how ready we can be, but we've seen this also as an opportunity that we need to grab, especially in terms of improving our own water and sanitation services. And we also live in the developing countries, and just like ourselves, it may be actually be not affordable, as Peter has also mentioned, actually to have these widescreen programs of clinical study, of clinical testing, so that we can know where these new infections are. So, and this can also be a problem when this pandemic peaks. So therefore, these sewer and non-sewer systems, because in South Africa, we've got both of them. As you see in the picture, we've got people living in rural and also informal settlements, and also people living in well-established areas with sewer systems. But we see that as an opportunity that we can be able to use this system actually to track or to trace the COVID-19 spread. And I'm struggling. Okay, the next one is about the wastewater, is the map about the wastewater treatment plant. And in South Africa, we have got more than 900 wastewater treatment plants, and the map, which I'm trying to show here, shows how the distribution of this of these plants are, or these facilities are. And when one looks at the epicenters that has just been shown or published by the Department of Health in South Africa, one could see that there are actually facilities that one can tap into in terms of getting samples that we really need in order to come up with the results that may make us to fulfill our objectives and make sure that our programs actually becomes what we really need in terms of tracking and monitoring the disease. We also have our program that we have just put together in terms of the surveillance itself. I'm sorry that my slides are not moving. I hope, but I will send the slides to you. But in terms of the surveillance program itself, we see it hanging actually on the bigger program that we really have, which is about the water quality, sanitation, and the health program. And under that, then we can have this national wastewater surveillance program, which can actually have so many components under it in terms of sampling, analysis, data analysis, the GIS mapping, and so on. But on top of that, we would also want to have some research projects that support that program. And these projects can come at different phases and for different purposes, actually to ensure that we manage and also address different gaps that we really have. So research projects will support that, laboratory services as well with that even our partners have, and as well as having the panel of experts that can also assist us to make this program functional and also very effective. In one of the slides that I've put together, I was showing that relating to the launch that we're having today, our billboard actually is quite clear in the sense that we would want you actually to notice or to realize that we would want to have a program that have got a proof of concept that everybody can have confidence in, and actually it has actually well established. And that's something that Nhlanhla actually will talk more about it. So their slides will have that. And on top of that, we also want to have the pilot monitoring kind of activities or program, the way we will go around the country, especially targeting the areas that already we are seeing them as hotspots, so that we can have samples and then we can start talking sense from what we are seeing or what we are seeing or monitoring. And then the last thing that I've put that in that billboard is the issue about the national wastewater surveillance itself, that we will actually build it in 3 phases. First, a proof of concept, then the pilot scale monitoring, and then the surveillance program itself. So in conclusion, which is actually my last slide, which actually is not coming through. The benefits of things that we are seeing coming from this program is the issue relating to us being able to determine the scope of the outbreak, which is actually independent or hand in hand with the testing of patients. So it can also address some of the question that the question that has already been asked in terms of, can we really detect where the problem is? So we can use that. Sorry, it gave me some. Yeah, this is a billboard that I was talking about. And then my last slide. And also it could allow us to provide some decision support, and which actually can make us to be able to inform our stakeholders in terms of the decision that they may take, and the kind of strategies that maybe they must come up with. And it should also allow us to be able to better anticipate the likelihood of the impact of the disease, and also of and even of the work that we are really doing, and even the data that we will actually be generating, and then track the effectiveness of the interventions. And then the last thing, to provide an early warning for re-emergence of this disease, as what Peter also has mentioned. So that's how I'll conclude, and I'll leave this to Dr. Nonhlanhla Gilibaila actually to take over from me. I hope our slide will run faster than mine. Thank you.
Thank you, Stanley. And then Nonhlanhla, you can go ahead.
Okay, let me take this one out.
All right, good afternoon, everyone. I will just wait for Stanley to take off the...
I did.
Take off the slides, oh yeah, okay. All right, hopefully everyone can see my slides, and hopefully my slides will move, unlike Stanley's slides. All right, good afternoon, everyone. My name is Nonhlanhla Gilibaila. I work at the Water Research Commission. So in the next couple of slides, I'm just going to provide a little bit more detail on the WRC program on COVID-19. So the National Department of Health has developed environmental health guidelines to address environmental health related questions and gaps. And accordingly, there is a section that covers the monitoring and management of medical or health care waste. As Stanley has mentioned, the WRC program aims to complement this government initiative by using a much broader environmental health surveillance initiative. And this initiative involves, sorry, I just got a note from the chair. Is that okay?
Yes, Nonhlanhla.
Okay, sorry about that. So as Stanley has mentioned, the WRC program aims to complement government initiatives by using a much broader environmental health surveillance initiative. This initiative involves a dedicated wastewater-based epidemiology initiative, and also within the One Health context, we'll see the commissioning of a couple of projects that are aimed at establishing the role of water and sanitation environments in the transmission and also transport of the virus. So the data that will be generated from this environmental surveillance initiative could involve a qualitative analysis of environmental samples, which could involve wastewater, feces, and also contaminated water in the environment for determining the general virus circulation in the populations. It could also involve detection and quantification methods that could be used for characterizing the trends and changes to monitor the infections in communities. And this data could also be used then for tracking the number of COVID-19 cases and also for mapping hotspot areas in communities. Much more sophisticated methodologies for sequencing and also risk assessment, which might involve actually testing the viability of the virus, could provide a full spectrum on the diversity of the virus strains that are in circulation, and also the clinical presentation of the virus itself. And also that data might actually enable us to be able to assess the risks that may be involved through exposure to aerosols in wastewater treatment works, the effluent itself, or any other water that may be contaminated with the virus itself. And also it's worth noting that the methodologies in these areas is still in the developmental stage. So as publications or as the knowledge improves, then we can see if that can actually be done. So this is what the phased approach to the program looks like. So there will be 3 phases. So in the first phase, as Stanley has mentioned, it involves some proof of concept studies to actually test the presence of the live virus within the environment. And then phase 2, it will be a much more detailed study where we're looking at pilot scale monitoring and also commissioning interlaboratory studies for testing and validation of the methods, and also to look at now going into some selected provinces for actually demonstration of the methods, and also looking at the infections using the wastewater-based epidemiology protocols. In phase 3, then we envisage a full-scale surveillance program, which can be rolled out throughout the country, and will also involve detection and testing of environmental samples. It will also include some sophisticated data analysis to enable the estimation of infections in the country, and also the development of risk maps based on the data, and also explore how this data can be incorporated into the national reporting platform. So these last 2 stages, partnership, collaboration, and also co-funding with partners is very important. As you can see, even from the timeframes that we are looking at a much more extended timeframes. So in the next 2 slides, I just want to share with you examples of some of the proof of concept studies that has been commissioned within the Water Research Commission. The first example is a preliminary study on the wastewater-based epidemiology approach. And I must say that, so this, in the WRC, there's already a completed study on testing the applicability of this approach by testing wastewater in selected communities. In the previous study, what was done is that we were looking at the use and also misuse of pharmaceuticals. So in this proof of concept study, we're hoping to use the knowledge that we've gained through that study, as well as knowledge that we have learned from our international partners for testing the presence of the virus in our wastewater treatment works, and also looking at the sensitivity of the method, the PCR-based method that already is in published studies, and also to establish the sampling and testing protocols for wastewater for the purposes of testing the virus. And this very study will also produce one of the first state of knowledge reports with a South African context, and also will make recommendations for the scale up into pilot and testing phases. So as you can see that this study does not yet include the on-site toilet samples. So we will be tracking international publications to see if we can also commissioning a similar study looking at that aspect. The second study is a study that we are doing with the National Institute for Occupational Health, which involves evaluation of health risks associated with occupational exposures to both biological and chemical contaminants in waste. So there is an element in this study that focuses solely on this virus. So this study will look at the occurrence, or will determine the occurrence of the live virus in wastewater samples, and as well as the aerosols that may be generated during the different stages of wastewater treatment, and also in the sludge. And also by design, this study will also look at the process efficiency for the removal of the virus during treatment. And using the data from there, the data will be used for making
insights or for deriving insights on the implications for wastewater treatments for health, looking at the exposure through aerosols and also wastewater effluent. And also by inference, the results will also provide insights on or will guide the implementation of potable reuse. And then, as I've already spoken about the bigger initiative, both the pilot and the national surveillance program, it will also be commissioned based on this proof of concept studies, as well as tracking the current science. It will involve a number of stages, as I've mentioned, which would be detection of the virus in different samples, environmental samples, your wastewater, your sentinel sites, hospital, for instance, hospital, contaminated surface water, as well as your fecal and or urine samples. And then these samples will then be tested and for the presence of the virus, and also there will be some sequencing that will be involved. And then using this information, the number of infections in the country can be determined. And this process, as Stanley mentioned, would be independent from the normal patient testing that is done in hospitals. And then from there, generate risk maps, and then also explore how this data can be used as for national reporting. So if you go into the WRC website, you will see that there is already a call for experts to serve into an advisory panel for this program, and also a call to laboratories, both research and diagnostic laboratories, for participating in this initiative, as well as researchers to also submit proposals in the areas that I had already mentioned. And to also stress again, the implementation of these programs will rely heavily on partnerships, as well as collaborations, as well as co-funding from different stakeholders. So it is also worth noting that within the WRC portfolio itself, there are already projects that are already running that are looking at human pathogens in water. So some of the areas, though, that we have marked for further research include specifically on the virus, to look at the potential of water and sanitation environments in the transport and transmission of the virus, to look at the fecal oral transmission pathway, as well as the fecal respiratory transmission pathway. And this last one is very important, especially the indirect transmission during fecal sludge management. So based on some of the publications that we've seen, notably the Hong Kong case study, we would like to look at how we can strengthen our own national building regulations to look at water and sanitation safety in buildings, so that there is a plan for management of water as well as sanitation to prevent incident, or in the case where incident occur, to look at protocols for incident management as well as response. So most of these projects will also involve an environmental sample banking initiative. So for starters, we are going to do an inventory to look at some of the samples that, some of the historical samples that are already in storage, and also provide recommendations for future storage of samples for future analysis. And some of the water quality projects that we are looking into are projects that are looking at the disinfection kinetics of high strength waste, as well as water quality aspects to actually check the presence of disinfectants due to the large scale use. As you might have seen, the large scale disinfection of surfaces, for instance, the bath ranks, taxi ranks, as well as some working environments, and to look specifically at the ecosystem responses and look at some key reactions which might lead to the formation of disinfection byproducts, as well as any toxicity aspects that may be associated with that. And based on that, make recommendations for future disinfection of the environmental surfaces. And also, along with that, as I've mentioned, that we had already started looking at the wastewater-based approach. So we intend to use that as well to track the use and also misuse of pharmaceuticals, as well as illicit drugs within the environment. So some of the pharmaceuticals might be related to the SARS-CoV-2 treatment, and some of them might be due to use by the general population. And then lastly, we have seen that our partners have already issued calls for localizing innovations or for the detection of the virus. And so we are in anticipation, we await the results, because those results will have applications and also for the rapid and sensitive detection of the virus, also in environmental samples. Chair, I will end there, and with just providing some of the details for any queries that are related to any of these research areas that I've mentioned. The email is covid19@wrc.org.za, and also they can access the WRC website for more information on some of the calls, our annual call, as well as a dedicated page on our activities on coronavirus, which hopefully this presentation will also be loaded at. Thank you.
Thank you very much, Nonhlanhla and Stanley. I'm going to now move to pick up a few questions from the Q&A chat box. And as I've said, colleagues, we will not be able to answer everything now, but the WRC team will make sure that the WRC colleagues will make sure that we respond to all questions and we make them the answers available to everyone. So for now, I'll just like to, while we're waiting for Minister, to just ask a few questions to all the speakers, and the WRC team would like to respond. The first one is, so I've tried to consolidate some of the questions you'll see as I'm asking them. So the first one is about the fact that South Africa's Sewershed is very complex. We have pit latrines, we have dysfunctional sewage system. So how do we think, or how are we going to overcome these challenges in South Africa, also including the fact that not all waste from informal settlements and high density areas do go to a central waste management system. So looking at the South African challenges, do we really think that this approach will work for us? That's the first question. The second question is the issue, I think Peter mentioned that there was a detection of drugs in some of the samples. So the question is this not going to be used maybe, or the participant, would they be scared that this will use as a disadvantage to them? They'll be targeted based on the drug that is detected in the samples. And maybe in addition to that question, to say, how are the communities involved beyond the science of these programs? Do we educate them? Do we make them aware so that they are better equipped and have the knowledge? So that's question number 2, the community's involvement and this issue of detecting the drug. And then the third question, maybe that I'll pose for now, is they're speaking about the calibration issue. I think Peter mentioned the fact that they use previously monitored results to calibrate. But then the question is, how then are you able to test the samples from a different site if you're using those previously calibrated sample from a site different from the current one that you're using? So the calibration issue, the community issue, and then the South African complex system. If I can just get answers to those from our speakers, and then I'll pick up on 3 more questions. Thank you.
Well, this is Peter. I can address a couple of the questions. The last one with regard to calibration is very important, and this is why we're launching this interlaboratory comparison. This really has not been done extensively, and it's very important to see how the results compare across laboratories. And in particular, if we start looking across communities in a given country, as has been done in the Netherlands, is being done in Spain, in France, in Australia, in Canada, in many parts of North America, we have to be able to understand how the results compare. And this has not been demonstrated yet. That's why we're doing the interlaboratory comparison that we'll be launching here just in a couple of weeks. With regard to the first question about the wastewater system as it exists in South Africa, this really speaks to the importance of carefully designing the study to try to answer the questions that are going to be particular to the community that you're looking at. And so I understand that there are communities that don't necessarily have a central wastewater treatment system. That doesn't mean that this tool can't be used, but one has to be very clear about where we're taking samples and why, and again, the questions we're trying to answer. The second question of the three that was just shared was one about community and engaging with the community. And one of the things that's very powerful, I think, about this tool and important about this tool is that it's giving a community level assessment. It's not an individual assessment. And so it's free from bias in the sense of who's able to get a clinical test. It's really able to look more broadly. And so I think it is very important to reach out to the community at the outset to be clear about what it is that you're trying to use this tool for. And I see Designate is there. He may want to add more to that point.
If I may, I just want to make one other point before I respond to some of the questions. Several people have put notes up saying that they want to see you. So when you're answering your question, can you please put your video on? They want to make sure that you're really here today.
I will do that.
You'll do that. Just to continue this point, we're not going to check who asked the question about the drugs and trace you. We can give you that guarantee. but this issue that you raised about non-sewage systems, and there's a bunch of questions in that regard, is critically important. Because while South Africa is majority sewage systems, and in that ilk, we have a matching to some of the partners in the developing world around how we roll this out. Dealing with the non-sewage environment may be the big contribution that South Africa can make, because that part resembles a lot of the developing world. So the change in the protocol and the change in the research design will be the contribution we're going to be making around how we deal with this in the developing world in a very significant way. It is more complicated, definitely. It means that you don't have the convenient sampling points that you would normally use around wastewater treatment plants. But it also goes on the back of a fairly intensive community engagement that has been going on since the beginning of the drought. So there are community structures that are already in place. And the minister may well talk about that when she gets online just now, that she's been nurturing over the last little while that we can plug into. So we can plug into a societal infrastructure to help us to engage on how this will work out. But it also reverts to a really critical point that Peter pointed out in his presentation earlier, and he gave a lot of emphasis on it in the presentation, is the communication strategy is really key. That we are drawing in a partnership as opposed to the classical science paradigm of using communities as subjects of research. And I think if we manage to do that in a reasonable way, we will be in a much smarter space. The last point I want to make is to emphasize something that was on one of the last slides of Non's presentation, is that we want to make a substantive investment in new innovations in this domain. And if possible, in community-based innovations in this domain around finding cheaper, more accessible techniques to be able to achieve this end. But I'm sure Stan and Nons have a fair amount to contribute.
Thank you, Desigan and Peter. Non-Class, do you want to add any more input?
Yeah, from my side, I think the questions are very exciting, and I think Non-Class will help me actually with the last two questions. I guess that's what maybe she will talk more about. But with regard to the issue of the complexity of our country and how our sanitation conditions or situation is, I think Desgen actually explained it quite well, and even Pete actually mentioned things relating to design, that I think we should actually have a better design to be able to accommodate those people or those communities living in those informal settlements and those that still use other kind of sanitation practices. But surely we can be able to design in such a way that they are not left out. And I think maybe let me stop there. Nonhlanhla will take over from there.
Okay, thank you, Stanley. Probably maybe just to add to what you both of you have said is that, so as I was presenting the proof of concept studies, I did mention that what we're going to look at in the beginning is to commission separate studies. So obviously the first one is on the wastewater, surveillance of wastewater, but on the side also we'll be looking at commissioning separate studies that separate studies that are going to look at taking samples from on-site toilet systems to cater for the different sanitation systems in South Africa, and then try to test the methods on those samples. And then once we are confident enough of the methods and also the results, and then when we go into the pilot and also the full-scale monitoring studies, we're going to look at how we can then match that into the one reporting, or also use the results from all these initiatives for reporting. And also I saw that someone also mentioned the importance of interlaboratory studies. Yes, I already mentioned that what we're going to look at also in the pilot phase is also look at commissioning some interlaboratory studies to also look at the different detection technologies. As you may be aware, you can see that already literature is showing that the sensitivity in the detectors between a conventional PCR and also some of the latest, say, digital technologies, there is some advantages with some of the imaging technologies. So we are going to also look at that as well.
Thank you very much, Nonhlanhla. And thank you, our colleagues. I see there's a vibrant conversation going in the chat box. I'll keep on doing that. There's still a lot of questions that we're having, but I want for now my panelists or the speakers to kindly keep these questions in mind when we move to now the second session, where we'll be having remarks from the South African partners. So just keep the question, but you'll answer afterwards. So the first question was, does the WRC already have partners to implement this program with? And the answer is yes, of course, because some of them will be talking just after this. And then, but we'll respond further about this question. And then the other question is, if yes, are you still open for more partnership? Yes, we are open. And the next question regarding the WRC was the timelines and the budget. Can you share a bit of what are the timelines and the budget allocated to this surveillance program? Question number 2 was on the standard operating procedure. So people are asking, is there a common or a standard, standard operating procedures that countries can use, or does each country have to design their own standards? The third question is there any link between the COVID measures in this wastewater treatment and how many people are affected? Can you be able to kind of balance it to say, if there's this much detected, it means this many people are affected? So I'll just want us to, my speakers, to hold on to those 3 questions, but would like to please move to the next set of talks that we'll receive from the WRC partners. And the first person that will be speaking to us will be Prof. Angela Mathieu, who is from the South African Medical Research Council. She is the Director of Environment and Health Research Unit at the MRC, where she leads multidisciplinary research programs on housing and health, climate and health, and also exposure to persistent toxic substances in South Africa. Prof. Mathieu will be sharing with us from the medical perspective what are her thoughts, her views about this surveillance program, and of course, how is the Medical Research Council going to be partnering with the WRC as we implement this program. Over to you, Angela.
Thank you very much. Let me start by thanking the Water Research Commission for a fascinating webinar. It's been really encouraging to hear in greater detail how much is already underway and what is already unfolding. By way of introduction, I'd like to say that around a century and a half ago, at the time of the first industrial revolution in England, when insanitary conditions and disease outbreaks were rife in their cities, it was the outcomes of a partnership between the health, water, and wastewater sectors that played a historic and powerful role in preventing disease and saving literally millions of lives. That partnership was instrumental in laying the foundation for the forerunners of the water supply and sanitation systems that we benefit from today and that also underpin modern public health. More recently, partnerships between the health and the wastewater sectors have been at the heart of wastewater surveillance programs that have proven invaluable in addressing public health problems such as poliomyelitis, hepatitis A, norovirus, measles, and cholera. Wastewater surveillance was in fact an important public health tool that led to the successful global eradication of poliomyelitis. And today we are once again looking to wastewater surveillance in the hope that it will become a game-changing tool in our package of interventions against a novel disease that is wreaking havoc across the globe and which right now is being transmitted at an increasingly chilling rate in South Africa. Yesterday, we saw 767 new cases of COVID-19 confirmed in South Africa. And on Sunday, there were 1,200 new cases. And in addition to this public health challenge that we're facing at the moment, in our country, we also have the very highest levels of tuberculosis and of HIV in the world. And given our extreme inequality and the widespread poverty that we have, as well as our resource constraints, there's particular anxiety about how the transmission of COVID-19 will unfold in South Africa and who will bear the brunt of the disease. In this light, and in the face of the limited capacity that we have for human testing and tracing, it is imperative that we investigate and assess with a sense of urgency all potential tools from across sectors that may offer cost-effective support to our efforts to combat the transmission of COVID-19. And wastewater surveillance and epidemiology is currently amongst the most promising of these. It gives us hope of achieving what we need most in South African public health right now, which is to identify hotspots, to direct our limited resources to where they'll be most effective, to commence testing and tracing in places where they'll make the biggest difference, to identifying those who need to go into quarantine and isolation or to get treatment at as early a stage as possible for those who need it. We have many challenges around our wastewater system that's already been mentioned by previous speakers, as well as people on the chat line. But it still is a very hopeful position that we're in at the moment, and the South African Medical Research Council is very pleased to be part of this crucial initiative by the Water Research Commission, the Water Research Council. It's particularly heartening to be part of this launch today of a cross-sectoral partnership of the water, wastewater, human settlements and public health and other sectors in which we can join forces once more to prevent disease, to save lives, and to contributing to saving our national economy. We commend the Water Research Commission on the launch of this important program and are looking forward to jointly making a contribution to stemming this dreadful COVID-19 epidemic as it's unfolding in South Africa. It is also our hope and our intention to work with the Water Research Commission and other partners in the longer term to explore how the benefits of wastewater surveillance and epidemiology can be applied as a long-standing and dynamic program to combat other priority diseases in South Africa, such as measles and hepatitis A. We believe that the sustained national wastewater surveillance system in our country is critical now, but will prove to be of increasing consequence as the specter of climate change continues to unfold and we see changing patterns of disease across the world. And on that note, I'd like to once again congratulate this organization, the Water Research Council, on this initiative, and to thank you all very much once more.
Thank you very much, Angela. We will now move to our second partner, who will be representing the one of the South African Water Board. That is Dr. Dimakatso Morusi, the CEO of over the past 7 years for what we call Bloom Water, which is one of the South African Water Board. Dimakatso, the floor is yours. You are muted, Dimakatso. Tabile, can you unmute Dimakatso, please?
Yes, can you hear me now?
Yes, we can. Thank you. The floor is yours.
You still can't see me. I'm trying to also try to put the, yeah, I think everything is fine now. Good afternoon, colleagues. Afternoon, everybody. Thank you for inviting me to this wonderful initiative. It is a known fact that this global trouble started already in June 2020, and therefore the impact of this virus is very much unknown in this sector of water and wastewater treatment environment. However, it is important, and I would like to first congratulate the Commission for having started this wonderful initiative, because at the moment, nobody knows anything about this virus in this environment we are in. We already have a challenge in our institution of having been affected by this virus. Hence, one of the important questions that came in from the board was, should the whole workforce be infected? Will we still be able to provide water to this 1.2 million population that we are servicing? Hence, the same question can be asked to say, where is this coming from? What is the effect of this with regard to water treatment? We know that in our country, some of the water boards are not dealing with wastewater treatment. However, the municipalities that we serve deal with it, and the partnership is very strong, hence there shouldn't be a problem. This surveillance system will therefore assist in the sector in that the current challenge that I have already alluded to will be answered once we know the source of this virus with regard to wastewater treatment. We also believe that technology innovation should also come in through this initiative to assist the sustainable supply of water and the effective operation of wastewater treatment to the communities that we serve. We have seen in the past, and we are still currently seeing, the contamination of water streams, compromising the quality of water in the areas that we service. Therefore, we are looking forward to work with you to ensure that we go deep into the source of this contamination. And I want to believe that this kind of surveillance will give answers to that. We know that the area, our main source, which is Caledon River, where we get water from, is heavily polluted. The Poor River is polluted by both Lesotho and South Africa because we share this source. Hence, if you go there, you'll find contamination with all sorts of pollutants that you can think of. starting from pampas, animal skins, and everything that you can think. And you can imagine the impact that it has, the negative impacts that it has on us as water board, both from Lesotho and also from the Free State, because of the amount of chemicals that we have to inject there in order to purify and ensure that people get quality water. Hence, we really feel that we should be part of this initiative in order to address the issue of river health program that we have initiated together with you guys. You already know that you supported the initiative, because the cry from our sector was to say, look, our main source is this Caledon River. However, we are sharing it with another country. What is happening, you can't blame it on any other side except from both, because that's where pollution starts. You also see from the communities that we service, the sewer that is flowing, commonly flowing all over the communities, all over the street, polluting even the underground water that we are trying very hard to protect. How are we going to support this initiative? We have already committed to giving samples, not only of water treatment works that we have, we also, the wastewater treatment works where our regions, for example, with regard to Blue Water, we have about 4 regions. Hence, you are assured of getting the samples from these regions, also from the rivers and other water streams that we are using. I want to believe that the role of the water boards is very, very important. Hence, it is becoming clear that without this partnership, the program is not going to succeed. Hence, we reiterate and commit our support to this program to make sure that it runs well and give us the results that we want. I want to believe that once this surveillance is over, I'm not sure, I saw that you are going to take almost, if I look at your reviewed time frame, it's almost 8 to maybe to 10 months. We really would like to be part of this, because we want to see desirable results that is going to assist the problems that we are having as water boards. I'm speaking on behalf of Blue Water, but I know that even my colleagues around the country are having similar problems where rivers are polluted and there is no answer to that. Where you have seen that one of the speakers has already mentioned that if you go through our municipalities, most of water treatment works are not working. And I know Free State is not different. We have similar problems. Wastewater treatments are not working, hence the sewer is flowing throughout the streets of our communities. With that, I would like to congratulate this the Water Research Commission with this initiative, and also reiterate that we would like to see ourselves as part of this and other water boards going forward. Thank you very much.
Thank you very much, Dimakato. We really do appreciate. And we'll go to our third partner, who will be representing the South African Local Government Association, SALGA, and that will be Councillor Tamingubani, who is at this webinar. He's really representing SALGA as the chairperson of the Water and Sanitation Portfolio Committee since 2016. Councillor Ngubani, the floor is yours.
Thanks very much, Program Director. I wish to bring warm greetings on behalf of the National Executive Committee of South African Local Government Association. And also greetings to everybody who's present, the leadership of Water Research Commission, water sector colleagues, distinguished guests, ladies and gentlemen. The COVID-19 pandemic has exposed our strengths and opportunities, threats and weaknesses as a country and the world. Together with our societal challenges of inequalities, unemployment, and poverty, among other factors, have actually complicated the battle against the pandemic. COVID-19 has also revealed limitations and capability of our infrastructure in addressing the needs of vulnerable communities. It has also, however, afforded the opportunity for us to rethink and forced us to collaborate in a quest to fight the spread of the virus. When the lockdown was announced by His Excellency President Ramaphosa, it meant that, one, we are all confronted by unprecedented state of affairs, which then requires a business unusual approach. And thirdly, COVID-19 has compelled us to adopt an extraordinary method of conducting the business. Ladies and gentlemen, we wish to express our sincere gratitude to the Honorable Minister Sisulu for collaborating with our member municipalities in a quest to scale up access to water to vulnerable communities during this exceptional period. We thank you, Honorable Minister. Ladies and gentlemen, since the commencement of the lockdown, I've observed that majority of the decision taken by Minister of Health was informed by sound research, science, and technology. Professor Karim has been instrumental in guiding the Ministry of Health in making key scientific decisions on how best to contain the virus. Equally so, as the water sector, we ought to base the decisions during this period and beyond on sound research, science, and technology. I am therefore pleased to be part of today's launch. Importantly, we wish to congratulate the Water Research Commission for pioneering the science behind the monitoring program of COVID-19. As a representative body of local government, we wish to pledge our unconditional support to the program. Program Director, notwithstanding the launch of this innovative program, we must always be cognizant in ensuring the vulnerable communities are protected during this unprecedented period. Our collective mission must be to ensure we use available resources, science, and technology to safeguard the interests of vulnerable communities. Our decisions in whatever water and wastewater treatment processes and technological advances we employ during this period must seek to protect our water sector and the communities we serve. As I move towards my concluding remarks, I wish to propose as a way forward the following. SALGA and Water Research Commission work collaborative in rolling out the program nationally. Number two, also wish to propose that we consider working with the Municipal Scientific Forum to join this battle. Municipal Scientific Forum in perfecting and enriching the science behind the program's configurations. We also wish to propose that we consider establishing a multidisciplinary forum that will advise the sector in making sound scientific decisions in preventing the spread of the virus through water and wastewater facilities. Number four, develop a prevention toolbox that the sector, particularly municipalities, could employ to minimize the spread of the virus. Number five, we also propose that we amplify our pledge in working with the Water Research Commission in developing cutting-edge research in a quest to safeguard the interest of the water sector of providing good quality water. In conclusion, we must acknowledge that the water sector is not immune to the virus. I therefore wish to call upon all of us to ensure we also play a critical role in supporting the water sector, particularly our member municipalities during these peculiar times. The sector's responses to the COVID-19 will be judged by, amongst others, our individual and organizational contributions during these difficult times. This initiative will have far-reaching benefit to the sector and country. We should all rally around and support the Water Research Commission to realize this objective for the benefit of all on this continent. Thanks very much.
Thank you very much, Councillor. And thanks to all the three South African partners for sharing their views and also really endorsing this program and their interest to partner with us as we implement it further. I'm just going to quickly go to these 4 questions that I have. So I'll ask the people who are going to respond to the question to be brief before then we go to Jay. I think the first one that I've mentioned was the question where participant asked if WRC already has partners. It is clear we already have partners like Salga, like Bloom Water and the Medical Research Council. And there's many, many more partners. Of course, we couldn't have them all here speaking today. So we do have partners and we are still interested in partnership with more partners in South Africa and internationally. And if you are interested to partner with us, I've just dropped now in the chat box the email address for Jay Bagwan, whom you can contact and liaise further with either Jay or myself. Then we'll try to liaise with you to see how you can partner with us. So the questions that I would like the colleagues to answer, there's one that is directed to Nonhlanhla. So I'd like her to respond to it. And it says, Nonhlanhla presented the proof of concept and the different phases of the program. And she further mentioned that through this program, we would be able to estimate infections within a community. Can she just please elaborate what she means by that? So Nonhlanhla, that's yours. And then the 4 more that I want the other speakers to quickly handle is, the first one is that one of the standard operating procedures. Is there one standard or do we still use whatever is suitable for your country? The second question is there a link between the COVID that is measured and the number of people infected? The third one is how fast does mRNA degrade in wastewater? And linked to that is also that is there really a proof that COVID in wastewater posed another transmission route? And then the last question was, actually it was a comment a comment rather. They're saying that in South Africa, there's lots of community involvement that are driven by the Department of Water and Sanitation. So the colleague was saying we should explore how we can work with this existing community forums because there's about 115 that exist. He just believed that that could be a very good platform for the WRC to also tap into as we implement the program. So I'll start with Nonhlanhla, and then I'll give the floor to the other speakers if you would like to just comment briefly before we move to Jay. Thank you.
Okay, thanks, Mamohlading. Hopefully everyone can see me now. Okay. Okay, anyway, let me answer the question. So the question is, someone wants to know how the number of infections can be estimated by testing wastewater. So I will use what currently we know based on the previous WRC study and also based on the studies that have been done by some of our international partners. So basically, I mean, let me start by maybe differentiating between maybe the typical hospital testing method where when you test a certain individual, the reporting is based on the number of tests that are conducted, and then the reporting is based on the number of positive tests. And then, but when you take, say, wastewater samples, so now those are pooled samples that are containing both your water as well as the feces. So you would need to apply a number of correction factors So first of all, the correction factors will enable you to estimate the mass load of RNA copies in a wastewater. And also, if you also normalize that information using your population estimate, then you'll be able to estimate the number of infections based on those parameters that you would use. It is an elaborate calculation, so I can share maybe the report from the WRC study and also a number of other reports based on what our international partners have already published. Thanks, Chair.
Thank you, Nonhlanhla. And then the other questions, colleagues, you can just go ahead and pick the one you'd like to respond to. Thank you.
This is Peter Gravatt. I'll respond to the question about the persistence of the signal in sewer sheds. This is one of the areas that we're going to launch a research project on in the very near term, because this has not yet been demonstrated how long the signal persists and how it changes as the RNA flows through the sewer shed. It's a very important question if you're wanting to use the tool to get a better understanding of what's happening in particular parts of the community. Like if you're going upstream into a sewer shed to collect a sample near a hospital or near some other source of an outbreak, it's very important to know how that signal changes as it transits through the sewer from that location to the central collection point. And so that's an important area of research. It's not yet been demonstrated how those changes occur over time.
Thank you, Peter. The rest of the WRC colleague, the standard operating procedures, the link between COVID measured and the number of people affected and all those, Des?
Yes, thank you. Look, some of those we're working out right now in the proof of concept phase, including issues around the budget, because the budget is a little bit of an open-ended question currently. It depends on how much we can actually cover. In fact, we're viewing it in the opposite direction, that depending on the budget availability, we will design the full-scale program to accommodate that. So if the budget is squeezed, then it minimizes the number of hotspots we can engage. If the budget is expanded, then we can cover a lot more. On the issue about whether or not the virus is still virile in the wastewater is a useful question. But the literature is pointing in the direction of dilution currently, that there isn't a sufficiency of concentration for this to really be a transmission mechanism. But a lot more work needs to be done in that domain, and there are bunches of folk all over the world that are engaging that question right now. The bottom lines around this, though, is that we, as I said before, is that the first part of the design is developing out a surveillance tool. And in the course of doing that, the science questions are going to pop up at a huge rate, at a catalytic rate, and they're already doing so. And we have to plug into these to see what kind of information that we can really draw down. But the 2 points I want to make as part of my last words around this is, one, we have to have a much more material strategy around the community engagement. You know, the issue has been raised around the fora that already exists. We know about the experience of the NGO network in the Vaal system that has turned out to be very positive, and these are really encouraging signs. And we have some people attending the seminar for the DWS in the Gauteng region, and they know a lot about this. So this is an area we want to explore a lot more. And the other thing where I think we may need to have a special webinar is around the engagement of the private sector and the role of the private sector. Because we have some folk in the seminar from members of the Water Business Chamber, or the Business Water Chamber rather, who are looking at this from an effect on business point of view. We have folk that are engaging on the on the back of the possibility of getting into the innovation space around this, and the room for participation is very wide. In fact, one of the things that we may need to consider inside the WRC is whether or not we put out a special call around the innovations in this domain. So colleagues, there's a lot to explore. I think we made a great start, and I see on the screen that we have Jürgen Kochel. Jürgen is the chair of Ministers' Council of Experts, and I think he wants to signal something. So through you, Chair, you're right. Jürgen,
can I put on, sorry?
Please go ahead.
Yeah, I'm just calling the minister now to join you.
Terrific.
That's right.
Terrific. I'll start introducing her as you're doing that.
Yes.
Okay. And maybe one last point before the minister comes on this. You know, the real hope around this, if this is not too ambitious, is that our engagement around this wastewater surveillance program organizes to be a stimulus to be able to heal many of the other ills that are in the water and sanitation sector. And it has the potential to do so. It has the potential to give us a very good engagement model on the one hand. It possibly will give us a leg up on the technology and the optimization of our services. And it has the possibility of a set of new rules and regulations and policy innovation to help us to be in a much sounder space. But colleagues, it now gives me pleasure to introduce to you, welcome Minister.
Hi.
To introduce you to Minister Lindiwe Sisulu. For the South Africans among you, you probably don't need much introduction, but we have several international guests. Minister Sisulu currently is the Minister for Human Settlements, Water and Sanitation in South Africa, and this program falls firmly under her political leadership. She has also served in many posts in the South African cabinet in our young democracy. And just to scare you, two of those were defense and intelligence. So whatever you say, she's going to be able to find you. Ma'am, I know you're on a really tight schedule.
Yes, yes.
The floor is yours.
Thank you very much. I'd like to say good afternoon to everybody. I have very limited time, but I thought that I would come and thank you all for giving us the time that you are giving us. The work that you're doing for us is invaluable. Invaluable, especially at this time of COVID-19. The Minister of Education has announced to the whole world that she is expecting support from us in the area of innovative ideas around sanitation and etc. And we have called a special meeting with yourselves so that we can come together and find a quick solution to support the government of South Africa. I know that we have international guests amongst us, the Global Water Research Coalition. I'm extremely grateful that you've given us the time, especially the CEO of the US Water Research Foundation, Dr. Peter Gravet. Am I pronouncing it properly, or is it a South Africanized way? And who I'm told was the keynote speaker today. Thank you very much for taking time to address us on this matter. I'd like to thank the universities who are involved in this endeavor to assist us find innovative solutions. I'd like to thank the CSIR. They've always been a very supportive partner, the Medical Research Council, and other science councils that we have around the country. I'd like to thank also SALGA and the water boards and the catchment area agencies. The list is long. All of you who are there assisting us, my own advisors who are there as well, for taking time to assist us. We are in a terrible bind. In about 2 weeks' time, our schools will be going back to, our children will be going back to school. In the most rural areas of the country, we do not have the facilities for them to be able to have a healthy environment around which to resume their studies. It is, we have very tight deadlines. We are battling like the rest of the world to keep on top of the situation we're in with COVID-19, and it's a catch-up game. We work almost 18 hours a day trying to find solution to each and every matter that comes our way. And I had asked my Water Research Council chair to please convene you today so that we can find some solutions that you can share with us, so that we are able to take ourselves out of this situation, the situation that we're in. I am currently in a meeting of the National Council which deals with the regulations of every stage we're in, because every stage as we go down has to be regulated, and each of those regulations has to be understood by each one of us and agreed to by each one of us. There isn't a single day we don't spend more than 8 hours on these regulations and any other attendant matter that we come across. It's a grueling time. I depend on you to help us, and I'm grateful that you're there. Thank you.
Thank you very much, Minister. I can tell you that there is a global solidarity project that has developed around this COVID-19.
Yeah.
And the South Africa is going to be a beneficiary of that. And South Africa is also going to be a major contributor of that as well, because what we're managing to garner from colleagues like Peter, and there are several that are in this seminar, we too must in turn help to carry through into the African continent. And collectively, I think we could use this as a catalytic point to get to somewhere better. But thank you, ma'am. Thank you for making the time to share with us.
Ciao, ciao. Put on your mask.
Got it. Thank you.
Thank you again for accommodating us. So I wish you well. All the best.
Thank you very much indeed.
Take care.
Thank you.
All yours.
Yes, thank you very much. It was nice to have the minister on board. So now I think, Desigan, you'll be the one just giving your final remark or closing remarks, and then we end the session. We are 3 minutes before the scheduled time, which is 3 minutes before 3. So just quickly your remark, and then maybe also to touch, because Jay's not going to be coming after you, Des, to just say what's going to happen after this. As you know, we're planning another webinar and so forth. So just your closing remarks and what's going to happen after this. Then I'll close the meeting. Thank you.
Thank you very much. The first thing to say is thank you to all of you. Your contributions have been absolutely magnificent. And, you know, this is a chapter of a global project, and we are completely committed to contributing to that. And the partnerships that we have already developed around this are already extremely powerful. I've taken careful note, Councillor Mayangubadi, around the 5 things that you want us to engage, and I think we will pick that up. But I also want to emphasize that it's about contributing to multiple agendas. You know, for this community of practice, the focus that we have is around the wastewater issue as a surveillance tool, and then eventually that surveillance tool helping us to organize to move very rapidly into a much better wastewater treatment space. And this includes the whole sanitation value chain. But the point I want to also add to that is what Angela put out, is that the way we want to design this is to organize for that effort, that investment, to have a multiplicity of benefits. Some of them are very direct and obvious, like contributing to better public health and getting past this epidemic, and getting past this epidemic in a way that organizes for us to be able to deal with the next one much more fluently than we are able to deal with this current one. But also some that are a little less easy to see, like the contributions to the water, energy, food nexus, as an example. And we must continuously do that, because eventually we want to create this multidisciplinary initiative to organize for us to get past this bump called COVID-19, but also onto a path of sustainable development for all of us. So my very sincere gratitude to all of you. You will know that this webinar, which is also running live on Facebook, will be available to all of you together with the presentations. And we want to continue the conversation, and we would really like all of you to get involved in these surveillance projects all over the world, wherever you are. Thank you, Chair.
Thank you very much, Des again. So we've come to the end of our session. I would just like to quickly thank the WRC team who put together this brilliant webinar. Thank you very much, colleagues. Thank our speakers, Peter, Angela, Dimakato, and Tammy, and of course, Non-Klein Stanley, because they were also speakers, and the minister in her absence. And also thank you, the participants, for making time to join us. I think we had very good numbers throughout the session. We thank you very much for your time and your contribution, your questions, your conversations that you were driving in the chat box. Our host, Tobile, who made sure that everything runs okay. And as Desigan has said, we couldn't answer all the questions, but we promised that we will respond to them and we'll make the answers available to you. And the PowerPoint presentations will also be made available to you. We'll email them to you, but they will also be available on our Knowledge Hub, the WRC website. And with that, I thank you very much. And the session is closed. Thank you. You can log off.